the company may have hired people to do what we would determine to be struck work. In other words, work that our members would do but currently are not doing because they're on strike. So it's our understanding that if a company comes in or a contractor comes in and is doing our work, that's our work, we have a right to picket them at that location where they're doing our work. So that's what happens. If people come in and do work that members would do had they not been on strike, we have a legal right to picket that location. That's what we're doing. We have had just tremendous professionalism on all our picket lines. We have not had one incident in Rhode Island with the police. Certainly, any type of activity, vandalism, there's been nothing like that in the state of Rhode Island. So that's a credit to our membership that we're doing this professionally. We're getting our message out. We're working with all the police departments. We're working with the public. We're trying to get our message out to the public, what's going on, and we can do it in respect. One of the major focus from the union standpoint are jobs. Obviously, you're aware, Rhode Island, we got the third highest unemployment rate in the country. Verizon has downsized the unionized workforce 35% over the past 3 years. And the unfortunate part about the downsizing is that they're actually moving jobs offshore to places like India, the Philippines, and Mexico. We have a fiber solution center right here in this building, a brand new state-of-the-art. The company committed to 350 jobs in the state of Rhode Island to take care of the FiOS initiative. FiOS, where now they have 4 million customers. Since 2007, they've grown to 4 million customers in FiOS. So it's a growing business, and that's landline-based, fiber optic cable.
They say that their landlines are going down, though.
Well, that's what they say, but they don't count FiOS. See, it's smoke and mirrors with that. It's high-speed internet, telephone, and cable TV. So it's a different accounting for that. Many customers are dropping their telephone, and they're converting to the package deal where they get the 3. Actually, it's cheaper that way. So that's not, getting into their arithmetic when they do all the figuring. But there's 4 million customers, undeniable. In Rhode Island, they launched in June of 2007, and obviously 0 customers. And Warwick was one of the first places they launched. You were probably over at Jefferson Boulevard, that garage.
That's right.
They launched, and now in Rhode Island, Warwick, Coventry, East Greenwich, North Kingstown, many towns are 40% penetration. So from 0 to 40%, that's remarkable. Now, unfortunately, and you were at the Jefferson Boulevard garage in Warwick, which is a great thing for the city of Warwick, they laid off 70 technicians out of that garage. They closed that garage. So even though the business is growing, they've been reducing employees, they've been moving jobs offshore, and that's what we want to stop. And that's really our primary goal during these negotiations is to stop the jobs from leaving this region. They make their money here. We want the jobs to stay here. Very successful, $26.4 billion. They're making a lot of money. We don't think it's a lot to ask if they invest in jobs in the state. Medical is a huge issue. And when you're talking about medical benefits, you're talking about the 45,000 employees who are on strike, the active employees, and over 500,000 retirees, because we all share the same medical plan. So obviously that's a huge expense for the corporation. The union has gone to the company and told them, we know it's a problem. We want to work with you on health care. We believe that the union can be very proactive with health care. The secret to keeping down health care costs is to ensure that people stay healthy. So you have wellness programs. You treat people for chronic conditions. Make sure they take their medication. They got diabetes, high blood pressure, something like that. So
preventive care.
Preventive care, it's huge. And wellness programs are huge to help keep people healthier, keep them out of the doctor's office, keep them out of the hospital. So we want to work with them. And that's what our proposal is all about. Now, we pay about 6% of healthcare costs now. Deductibles are out of pockets. We don't pay a premium, but our philosophy has always been that shifting the cost on healthcare doesn't solve the inherent problems we have in the healthcare delivery system. And that's what we want to work on. We want to solve the problems because you're going to keep on shifting costs, but it's a huge issue for the corporation and for the union. We want to work with them on that, and we've explained to them about that.